Dag iedereen, van harte welkom. Welcome to you all. Bonjour à tous. Welcome to this Climate Justice and Health Equity Conference. We're very pleased to have you here. It's been organized by Because Health, the Belgian platform for international health, accompanied by the Institute for Tropical Medicine and Belgium. We're talking about an urgency, of course, you know. We're talking more and more about it, so I'm really pleased to have this conference here today. The perception of the climate impact is what is going to be the subject today, and I would like to welcome Magalie Schotte as a first speaker to welcome you. She's the coordinator of Because Health Belgium. Magalie Schotte.
Dear participants, it has been almost 50 years now since the Club of Rome questioned the viability of continued growth within the ecological footprint. There was a message of hope too. They believed that the human race can create a society in which everyone can prosper on this planet Earth. The precondition, however, is that limits are placed on the demand for energy and materials. We have to do it for the future generations to be able to prosper. The study was translated in over than 30 languages, and the book has sold more than 60 million copies today. However, today, almost 50 years later, its message is still not well understood. In the years following, alarming messages came to us from the Arctic, for instance, where ice caps are melting and at an exponential rate, and the polar bear is losing its territory to survive. By 2100, the polar bear could be completely extinct. Activists from all over the world stood up and asked our urgent attention to save this polar bear. We were touched and felt sorry for this lonely, brave polar bear. However, let us be honest, this polar bear lives on the other side of the world. Future generations are so far away from our daily lives. Do we really care? Apparently not that much. The ice caps are still melting and the climate is getting hotter every year. Effects of climate change were first felt in middle and low-income countries. Those who had contributed the least to the climate crisis were the first to suffer from global heating. The weather patterns are changing, farmers aren't able to plan their harvest anymore, and people have difficulties to keep their heads above water. For the last years, we have been witnessing severe droughts, floods, heat waves, fires, typhoons, and so on over all the world. And not only the poor countries are hit by the climate emergency. Also Belgium, for instance, was the battle scene of a severe and killing flood. One thing didn't change though. It's still the most vulnerable people that are hit the hardest by the consequences of climate change. So our fight against climate change can be none other than a fight for climate justice. Today, we cannot turn away our head anymore from the polar bear or yet unborn or distant populations. Today, we must recognize that if we don't stop the global heating, all our health interventions could or even will turn out to be in vain. For much too long, the global health sector has seen the climate fight as something not on our plate. Climate change hasn't been at the core of our activities. But it has to be, because without climate justice, we'll never reach health for all, the health equity for which we, as Because Health members and friends, stand for. Good morning. I am Magalie Schotte and the coordinator of Because Health since the beginning of this year. And it's a great honor to welcome you here all at our international conference on climate justice and health equity. Today, as the global health sector, we are at the beginning of discussing this most urgent issue. Our conference will offer you a platform to share and learn from each other, to see how climate change impacts our health activities and programs, and to try to translate experiences from the field and research findings into policies and practices to tackle climate change. During our conference, we want to tell you a story. Today, we look how climate change impacts people's health and how we as humans need a healthy planet to be healthy ourselves. And tomorrow we even go a step further and we will look for transformative policies and health systems, for a transformative community approach to give us inspiration that comes from all of you to help us rebuilding our society and health systems in a socially and economic just manner within the respect of our planetary boundaries. And this conference is not the end, but just a beginning. We will set up a Because Health working group on climate justice and health equity to take forward the key outcomes of the conference and develop a range of activities that will focus on the climate emergency, transformation, and how global health stakeholders could contribute to this. For this conference, we have deliberately chosen to give the floor to those groups of the population that often aren't really heard or listened to at high-level conference. We are thrilled to welcome so many young, indigenous and women speakers. We are happy to welcome the student speakers. Their voices will give new inspiration to the debate and can guide us during our search for climate justice and health equity. I'm happy to be able to stand here and welcome you at our conference. As you might understand, it was a real roller coaster organizing this event, not only being at my first Because Health conference ever, and at the same time, the first planned hybrid Because Health conference. Unfortunately, we had to cancel our face-to-face event in Antwerp. And luckily, this hadn't had any impact on the program, and we were able to switch to a 100% online conference. This virtual conference gives the opportunity to connect with Because Health members and friends from all over the world. So please make use of these technical features of the platform. I will quickly guide you through the platform. To the left of the screen, you can see different zones of the event. The reception, where the program is visible. The stage, this is the original event in 2 languages, or you can choose for French or English, which allows you to follow the event completely in French or English. You can network during breaks. It's very easy. You can click on the button Networking, and you will be automatically matched to someone in the conference you can network with for about 3 minutes. And we also have a digital exposition where you can find research findings, cases and stories on climate justice and health equity that couldn't be presented during the day, seeing the limited time we have. And if you should have not enough from today, tomorrow you can push replay and you can see today's conference again. At the right of the screen, you have different options to interact. You have the chat, where you can chat with everybody present in the event. You have the Q&A to ask questions to the speakers. You have the polls where regularly questions will appear. And by accessing People link, you can send a message, private message to everybody, just clicking on the name. And if this would be a little bit too much, or you cannot find your way through this digital forest, you can go to the virtual help desk for which the link can be found in the chat. And last but not least, I like to mention all the people behind the scenes, especially the translators, our volunteer task force, the people of Storycatchers, Nathalie, my anchor and support, and Sophia, who will be drawing live sketch notes of all conference sessions that will be shown from time to time on the main stage, but that you can also look at in our exposition space. So I think I have said enough for now. I'm glad to give the floor back to Annabel van Nieuwenhuizen, who will be our host during all the conference and for which we will thank her sincerely. Have a nice conference.